the distribution is.
Yeah.
So you have a lot of people. So I hope everyone went through the videos that I had shared yesterday. Also, if some of you have got a chance to go through the what do you say, the recording again? Yes, no?
Yes, sir.
Right. So did you find any trigger points in these 2 days? Any cases that you thought might be trigger point? Anyone who's having clinic now? Okay, so we'll talk about that later then. Just a second. Okay, so we'll do a quick recap about the the main important things that we need to take from the session one, right? And we are talking about trigger points and especially myofascial trigger points. Why is it so important? Because we just saw it the other day that myofascial trigger points are present everywhere and affects as much as 85% of the population in some time of their life. Now, this is the most important reason why we should be aware about trigger points because it is affected, majority. And this study was done in 2010, right? And when at that time, they are telling 85% of the population, but now I think it will be like 95 to 99% of the population because it is that severe, and it is present in babies and children as well. So when you deal with small babies, you can also look into this aspect. Have this perspective, and the impact of myofascial pain on health can be severe as patients not only suffer from pain and loss of function, but also from impaired mood and decreased quality of life. Now, that is the reason why we are learning about trigger points because it is very tricky. Sometimes people show very severe symptoms, very painful, and finally you realize it's a trigger point, and all the investigation reports are normal, and still the patient is in pain. And anyone who touches the body should have thorough and deep knowledge of trigger points. That's why we're learning about trigger points. Again, those who went through the video, quickly, I know you saw the different types of muscles. I just want to select few things from session one, so we focus more on that, right? The three types of muscles, that's the smooth, cardiac, and skeletal. Smooth is for your visceral organs, cardiac for the heart, skeletal for the entire structure and movement, and the three types. And the sliding filament model, we saw in the video that how the sarcomere contraction slides and brings the actin and myosin together. The sarcomere contracts, and how it gets stuck in that position. And if we do not treat it, how the successive muscle fibers are also affected, and which leads to a trigger point within a taut band, right? A taut band is the muscle fibers like a string, and then you'll find a nodule in the middle. And we saw that skeletal muscles are made up of bundles of protein fibers. Just to uh, recap, just to refresh, just to think about the anatomy, the basic things that we learn: actin and myosin films, and how the calcium and ATP causes the binding and unbinding of the uh, actin and myosin filaments. So the next most important thing is, once the skeletal muscles work together to create inverse movements, we need to get that into our heads, that it is always not just one muscle which is responsible, but a group of muscle for a particular action, right? We talked about the motor units, how the impulse from brain reaches and how it contracts, and the three phases of muscle twitches. It was there in the video, and the strength and frequency of impulses, strength and duration of contraction. Now, the last two things we did not teach in class, but it was there in the video. I hope you saw it, right? Uh, we are talking about how the nerve impulse reaches and how it gives a command to our body. Suppose, when you want to lift something like a mouse, right? The Like this mouse, right? The nerve impulse will tell the body, and it will recruit only a little amount of the muscle fibers. But if you want to lift something more heavier, then it will recruit more amount of muscle fibers. Now, that is how, we need to understand how the muscle fiber works, how it contracts, right? And we also talked about the trigger point characteristics, right? Pain often exquisite and is present at a discrete point. And if you remember, a nodule is embedded within a taut band. If you remember the animation video, it shows that a nodule is embedded within a taut band in the muscle, and pressure reproduces the pain symptoms with radiations in a specific map. This is the most important thing in trigger points. The radiation, the pain map that the patients complain with. And pain cannot be explained in findings from a neurological examinations. Now, that is where our advantage lies, because all the reports are normal, still patient are pain. And now when you find it out, then they really treat you like God, and may induce autonomic changes. Also, very important that a long habitual posture, or if it is something untreated, it will slowly produce autonomic changes. That is why, if you have a fracture, if you have an injury, and during the recovery stage of fracture, if it's if there is some trigger point formation, and if it's not treated properly, if it's just left, what happens is gradually you can see a lot of changes, or it will affect the normal functioning of the body. And we talked about myofascia. Right, fascia in general is a covering, and myofascia is the dense, tough tissue which surrounds and covers all of your bones and muscles, right? We saw how it is all interconnected. So try to get this in your mind, how we start with a single muscle fiber, right? The trigger point is formed in that muscle fiber, and if it's not treated, it is affecting the around all the muscle fibers, and the entire muscle is restricted, or the movement is restricted. And when that muscle is restricted, along that facial change, there'll be secondary or tertiary trigger points that will be formed in another group. So, for example, we are talking about the back arm line. It will start with the shoulder, like the scapular region, the supraspinatus, infraspinatus, and it will go through your triceps to the extensor of the arm, right? And to the fingers, right? So sometimes if you do not treat an issue in the shoulder joint, what happens? The problem. I hope you can see, right? So if you have an issue in the shoulder joint, if there's a trigger point there, and if you do not treat it, if it leads to a restriction of a muscle in the upper back, right? It will also give tightening, or it will also give produce a trigger point, or a tertiary or a secondary trigger point along that chain, say suppose in your elbow. So sometimes cases like a lateral epicondylitis may not be because of the lateral side itself. It could also be a problem from the back, right? And it also helps transport. So you need to understand the importance of fascia, that how it is surrounded, across the body, and how it helps in transporting and moving chemicals around the body. So, and we also talked about the two different states. The healthy state, fascia is relaxed and soft, ability to stretch and move without restriction. Fascia helps to maintain good posture, range of motion, and flexibility. Now, again and again, we talk about posture and how it is important. If the muscles are functioning properly, it will lead to good posture. Otherwise, it will uh, lead to an imbalance in posture and will also give to other systemic issues as well. When something happens to the fascia, it loses pliability, it can become tight, restricted, and a source of tension throughout and rest of the body. And if a trauma, such as a fall, whiplash surgery, or poor posture, has a cumulative effect over time. Again, so this is what we need to understand. Why, when we do some treatment in a patient, who's about 40 or 50 years old, and suddenly you reach a point in somewhere in his leg, where he feels that there is a lot of tenderness, and he didn't feel that pain until he started his massage session, or his treatment. And then when you are treating him, then slowly he'll remember like how he was when probably 15 or 18 years old, and how he fell down, or how he, from a cycle or from while playing, and then he had an issue, and then that thing is still lying there. So you'll get a lot of feedbacks from the patient's body when you understand. This is the point where you'll get answers for all such complaints. So uh, you can see my screen, I hope. Yeah.
Yeah, we can see.
Okay. So let's talk about the different. We'll talk. So please keep all this in mind, and we'll start with today's exclusive session. We'll talk about different fibers of, the different muscle fibers, type 1 muscle fiber and type 2 muscle fibers, right? The type 1 muscle fibers are postural muscles and tend to respond to stress or overuse by shortening and become hypertonic. A trigger point in a muscle with a high percentage of type 1 fibers may take longer to respond to treatment. Now, this is the most interesting part, and this is why we keep talking about postures, habitual postures, importance of proper ergonomics in office, at home, if you're watching TV, and if you're continuously sitting and watching, because there are certain postural muscles in the body, which even when you suppose even you're standing, right? Uh, we have that picture. I'll just show you that. Uh, Please remember the type 1 muscle fiber is postural and tend to respond to stress or overuse. If you're just standing, it could be an overused muscle and it will lead to a trigger point, right? And the type 2 trigger points are built for explosive short-term activity and tend to become weak, atrophic, and hypertonic under chronic or sustained endurance. The trigger point in a muscle with a high percentage of type 2 muscles may respond more rapidly to treatment. That is why when some people come to pain, acute, recent onset, you do some sort of, like, say Agnikarma, or if you do like with the slaka, with a, like the dalga, like the honey, if you do, sometimes you get good result, because most probably that would be acute and would be of the type 2. But sometimes if it's happening in a type 1, if there is a dull aching pain and restriction, sometimes they don't respond to things like Agnikarma. So, and these are the type 1 muscle fibers. You can see the deltoid, the pectoralis major, the tensor fasciae latae, rectus femoris, and the muscles of the back, upper trapezius, latissimus muscle dorsi, biceps femoris, semitendinosus, semimembranous is the hamstring group, the gastrocnemius, and the tibialis posterior, right? You can also see the piriformis, adductor magnus, and the soleus, right? All these muscles, the postural. And if you can just think, if you can just look at it, you will know closely that, this are the area where you get more pain, and this is exactly where people have more issue with. Pain in the calf, pain in the upper, just behind the thighs, piriformis syndrome, the gluteal pain, sometimes feel like sciatica, lower back pain, shoulder pain, neck pain, right? Pain here, and then pain in around the thoracic area, just near the scapula, deltoid, deltoid right in front. You have the tensor fasciae latae, right? The TFL. When people are sitting, the hip flexors, rectus femoris. See, all these are restricted, and you'll find the connection, like how continuous standing will sometimes will lead to back pain, etc. When we deal about the fascia, right? So the evidence of trigger points in in 1957, Dr. Janet Travell discovered the trigger points generate and receive minute electrical current. So what they did was they, because of the action, because of the excess stimulation there, it generates slight, electric current, and they used it with a needle, a Teflon coated needle, and they could measure it there. And in general, when a muscle is in its resting state, the electricity is nil. But when small part of muscle contract, there is a spike in electrical activity. That is how they realized that, when, because of the contraction or the contracted state of these muscle fibers, there was electrical impulse or the electrical activity, right? And that's how they proved that this is how trigger points are formed, right? And interestingly enough, if you see a lot of studies based on acupuncture, even they will tell you the exact same thing, that every acupoint, when they try to do research, they found some electrical activity. I attended, Tirumala Varmology in Coimbatore. They're teaching Varmam, and even they share like how they did a study, similar study, to find out the electrical impulses on a Marma point, and they could find the readings there. So, like I said, please do not think that all these are same. Trigger point is different from acupuncture points. It is different from marma or varma points, because the theory based on it are completely different, right? But we need to study. I would always suggest, I had told this earlier as well, first try to study the trigger points, understand the trigger points, treat the trigger points, and then you can proceed to a marma. You will understand it better, right? So uh, let's talk about the trigger points now. And how do trigger points develop? Low level muscle contractions, uneven intramuscular pressure or distribution, direct trauma, unaccustomed eccentric contractions in an unconditional muscles, maximal or submaximal concentric contractions, right? And we talk about low level muscle contractions because when people are in, not active, right? When they're sitting in a continuous posture, when they do half things, right? It can be told as a low level muscle contraction. Uneven intramuscular pressure distribution is when you're sitting or when you're standing or when you're lying down continuously in an uneven pressure, it may lead to trigger points. Unaccustomed eccentric contractions is, when you suddenly start doing exercises, people are like, they sit at home like for a long time, and then suddenly they decide they want to work out. They go to the gym, they go for a walk, and sometimes they come back with pain, and then stiffness in the thighs, trigger point formations everywhere, and all that. And according to Ayurveda, we know what the roga karanas are, right? Hina Mithya Dimatra, that sloka, right? The Hina is the underused, Mithya is the improper use, and the Atiya. So when you're talking about trigger points, always think that is the Hina, Mithya, and Ati use of the muscles, right? That is the Roga Karna in trigger points. And very interestingly, when you talk about the Shiro Roga Karna, right? I hope you remember the slogan Ushnabitattasya Jala Pravesha Durekshanath, all that. What happens is in today's scenario, Ushnabitattasya Jala Pravesha, like when there is heat, diving into the pool in the sun, that's what we learn in college because that's the exact translation of that sloka. But actually, what does it mean? Right? Irregular exposure to temperature, right? Can lead to formation of trigger points. Now, this is why trigger point is so relevant. In today's world, people go outside when it's very hot. They come back into the car, they sit under AC, and then suddenly they start getting all this, pain, etc. They you go for a walk, you go for a run, and then you sweat and you come back, you sit under AC. Some people don't have time. When they are sweating, they have bath, right? And all this in practice, I've seen that all this can lead to trigger points, and that's why history taking is very important, especially in a place like Kerala where there is so much humidity. People who take bath irregularly, taking bath wrong time, mostly half during afternoon, right? Using improper Murda Thailas, they use a lot of cold, like, for hair fall. They go online, they buy, uh, what do you say, just looking at the ad, they buy an oil which does not suit their prakriti, and then they apply it and they fall ill. So, and they get, a lot of conditions like headache, vertigo, gastritis, and a lot of issues. So, that is why, we Ayurvedic doctors should understand what trigger point is, and we should educate the public. We should take history properly. We should all the history taking from now on should also consider the time of birth because it plays a very very important role in myalgia and pain, etc. In For every kind of pain, we always kind of see it as a fibromyalgia. That's a common term that we actually see. And sometimes, sometimes we just think about the prescriptions, and sometimes it does not work. People are still in pain. They go to doctors for painkillers, and still it is not, effective. So, what happens at the site of a trigger point? Now, this is a very interesting, uh, you know, cycle. It's called the vicious cycle of energy crisis, right? Hope, can you hear? Can you hear at least two or more yeses?
Yes, sir.
Doctors,
Yes,
are you
sir.
with me?
Yes, yes.
Okay, thank you. So, if you remember those who have not seen the video that I shared, please go and see it again. Here we are talking about the stress motor plate or the nerve impulse that comes, to the muscle, and it releases of excess calcium. It releases the excess of, this is the normal. What happens is, the nerve impulse comes at a site, calcium releases acetylcholine enzyme, releases, there is, the contraction of the uh, muscle fiber. And when it stays together, right, then what happens, more and more, what do you say, signal reaches that area and it becomes stressed. So what happens is when there is stress motor plate, there is release of calcium, release of excess acetylcholine enzymes, irritants, acidification is formed, and what happens is that affects the microcellular circulation, right? there is microcirculation dysfunction, lack of oxygen and nutrients. What happens is impaired waste removal, and then increased metabolism and energy demand because there is so much of energy demand there. It leads to pain and dysfunction, and when there is pain and dysfunction, it leads to increased stimulation of sarcomere, and then again formation of taut bands and contraction nodules, which again leads to a stress motor end plate, right? So if you remember that video, the animation, what happens is, this cycle goes and on and on and on, and what happens is it kind of spreads to all the other areas, right? In that animation video, we saw how there is one contraction of a nodule, one muscle fiber, and that leads to the contraction of the successive muscle fibers. They showed representing a green color patch, right? I'll just excuse me. I'll just play that video real quick again, so we are on the same page with this.
Not these problems point.
So I'll just skip all that. We'll come to the area where they show.
The trigger point itself can be felt. The trigger band follows typical patterns that in itself can be. Continue to zoom in. We can see the muscle fiber that makes.
So here's what happens.
Lines on the muscle fibers represent sarcomeres.
Here we are talking about the single muscle fiber, right? How there is a contraction of this single muscle fiber.
Like tiny pumps
this is how the normal contraction of muscle happens.
Sarcomeres can become overstimulated, unable to release their contracted state.
And here, what happens is, due to overstimulation, this sarcomere, it stays in that contracted state, right?
The segment of the fiber has become shorter and wider because of this. But also a different segment now becomes stretched by this tension, shown by the greater distance between the sarcomeres. Together, multiple of these sarcomere knots form the trigger point.
And you can see that one muscle fiber is stressed, and what happens is that leads to the formation of these sarcomere contracted nodules in the successive muscle fibers as well. And when that happens,
stretched segments of the fibers give tightness to the taut band in which the trigger point.
And you can see that it becomes a very tight band, and you can see there's a nodule right in between, and which is formed by the stuck together sarcomere bands.
Contraction, blood flow stops in the immediate area. The resulting oxygen starvation.
So this is what happens when there is the contraction, and when in this state of contraction there is no movement, it impairs the microcellular dysfunction, oxygen starvation, right? And as a result, that area becomes stressed, and the body, the nerve sends the signals more and more, so that it becomes a continuous cycle.
An accumulation of waste products irritate the trigger point. The trigger point will not release without proper treatment, which can massage directly to the trigger point.
Okay. So this is what that video really explains, right? Sustained dysfunction and sarcomere contraction leads to local intracellular and extracellular chemical changes, including localized ischemia or hypoxia, increased metabolic needs, increased energy, required to sustain contraction, failed to reuptake of calcium ions into the sarcoplasmic reticulum, localized inflammation, right? Compression of watershed effect on local vessels, energy crisis, and production of inflammatory agents which sensitize local autonomic and non-nociceptive fibers. Now, this is the explanation of what happens in when yesterday someone told about near cutter, right? It's a very common thing in Kerala. Near cutter is nothing but, like I said, when people take bath, after they are sweating, when they take bath, they suddenly get these cramps and pains here, and when that is continued as a habit, when people do it every day, what happens is more and more and more of that is affected, right? And that leads to a lot of pain and movement restriction. And since trigger points are formed, that will lead to many symptoms like headache, eye pain, blackening of eye, and vertigo, all those conditions, right? So, is this point clear? Were you able to follow? Are you able to understand what the whole? This is the main important aspect of why we should learn trigger points and what we are doing. This is what the physiology is. Are we clear here?
Yes, sir.
Yes.
Two. Any more? Great. Those who can't, speak, you can always just message and chat.
Getting, sir.
Okay, great. Isn't this the same thing what we are seeing in our clinics every day? People come with pain and dysfunction, a lot of disturbance, and we always what comes to our mind? How do we approach it as doctors? As Ayurvedic doctors, what do we see this as? Can someone tell me that somebody comes with a pain, here, neck pain, cramps, and what is the diagnosis?
Apabhava, sir.
Abhivahukam, yes, that is sometimes what we say. The common things. Just be free enough. There's no right and wrong because it's a completely a new thing. We are learning, so everybody are going to be right about this because you're all practicing doctors. You're all seeing these conditions. We always say it as a vata vyadhi, we say it as apubahuka. We say that what else? What else name comes to your mind when you talk about pain in the upper back or neck?
Sir, what I do is I take the history, their routine. So most of the time, as you said, there is chances like after exercise or directly after cooking, they go to bath. So they will be sweated, and after that bath and that change in temperature, body temperature, sudden change. And also after coming out of the bath, after shower, they come and sit under the fan or AC. So then directly AC in the car, like that. Sudden change in body temperature, I felt, is the most common cause, I felt.
Yes. And where are you practicing, doctor? Which area?
I'm not practicing now, sir, because of the lockdown. Our clinic is closed.
No.
I'm in Bahrain now.
Bahrain. Okay, so you have a clinic in Bahrain itself.
Not my clinic. I was working for someone else.
Okay, no issues. What I wanted to, the reason why I asked your place is because I wanted to see if this is common or if this issue is only in Kerala, or I wanted it was a
No, sir.
feedback for me to understand if it's happening throughout the world, because I've always felt
Yeah.
that those people are learning living the west of the Western Ghats, like the Kerala, Goa, Bombay belt, along that coastal line, Mangalore. We are susceptible to this more because it's more humid, right? And I've also realized that some people, like if they are in places like let's say Coimbatore, or places in Chennai, right? It's not very, even though it's hot, but it's not humid, and there it's not affected much. And I see that since Kerala, you have a lot of people coming from the Gulf, and uh, I've I've this is how I teach my patients. I tell them that, see, you can see that in your family, those people who are working in the Gulf, right? Uh, they are there in the Gulf. It is hot. It is 50 degrees. They are always in the AC, and just excuse me a sec. They are always in the AC, and what happens is that they are completely okay with it, and they don't really have much problem. But when they come to Kerala, right, and they are always having allergic rhinitis, they always sneezing, they always having problems whenever they come to Kerala. But they say that in Gulf they're perfectly all right, and every time they come home, this is the issue, right? Have you experienced this? Have any of you, your patients saying this? Any of your relatives have these problems? Have you ever thought about it?
Sir, what I felt is those who are working outside, like site work and all, the change we can see. Like those, not those who are working in offices. For them also, it's a problem. I felt, because they will be sitting under the AC. Direct AC will be directly on the head and shoulders. So
Yes.
I felt that is affecting them. And also, while going back to Kerala, same, some allergic problems arise for even for kids.
Mhm. Exactly. So this is why it is so important. Why we say so much about the importance of Murda Thaila, and it is really an art of prescribing Murda Thaila. It is very difficult. I'm still trying to get hold of it. Trying to describe proper Murda Thaila according to the season, according to the age, according to the condition. How it changes, and it was a very good practice. And trust me, since I've, like for me it's always trigger points and fascia. This is, and and then I apply the principles of Ayurveda and I treat. But to understand this, it is very difficult, but it's really surprising that when you learn more about trigger points, when you learn more about fascia and how it is connected, how these different symptoms that people show, you really understand that how advanced our real science is, because all this is mentioned, all the treatments is mentioned already there. It's just that we did not know how to decipher it. That was something it was lacking, right? So I would like to, again come back to this vicious cycle of energy crisis here. This is what happens. There is continuous stress in that area, right? Because there is more and more nerve impulse, nerve stimulation, because the body is sensing there is some energy block there. So, it sends these nerve impulse to help get rid of it. And in turn, there is more and more stimulation, and then in turn, there's more and more microcirculation dysfunction. There is more and more acidification in that area, and causing a lot of inflammation, and then leading to pain and dysfunction, right? And uh, and what happens is increased metabolism and energy, pain and dysfunction, and then increased sarcomere. And very interestingly, Sahadevan sir, one of his favorite things whenever he teaches classes, when he always talks about how the vata and pitta are always coming, vatam sahaja pittena. So whenever there is vata stimulation, you could say, there is acidification, which leads to more like a pitta imbalance, right? And then uh, he also mentions in many of his lectures, how the Asraya Sraya of Rakta and Pitta. So what happens is when there is inflammation in Pitta, it also affects the Rakta as well. So, there is a continuous thing in inflammation This is what really happens when you talk about posture, when you talk about improper bath, sitting on the lazy. Why do these people get these pain? And sometimes when there is excess of acidification, I think sometimes it will be better to do a pittahara chikitsa first and then go to a vatahara, not directly, because we always say that this is how we blindly learn. Like if it is hard, it is kapha. If there is burning, sensation is pitta, right? And and this is how we differentiate different kind of if there is just pain, if it's vata, if there is heat involved, there's pitta, and if it's very hard and rigid, and it's more like kapha, right? And whenever people come with neck pain, we consider it as a vata vyadhi. But when you go to the history, it could be related to a pitta, right? So first you do a pittahara, and then probably lepa, and then you go to a vatahara chikitsa, which is more effective, right? And that's why you could see that earlier, the Rasnadi or Rasnadi Kvashayam, Rasna Panchagam, Rasna Saptam, all this have, and people actually, for pain, that's why mostly I feel Amrutotram is more effective in cases like myalgia and fibromyalgia or these conditions, especially in practice, and that is the most prescribed medicine in my clinic, because it just has 3 ingredients and it is very, very effective in this condition. So just trying to get the picture of why this physiology is important and how we can closely correlate it with Ayurveda as well. So think about that, patient, think about that condition that you actually felt was little challenging, that people came to you and presented, and probably you wish you had more answer to it, right? So coming back to our trigger points now, how do we find them? We're getting into the treatment aspect of it, right? First, you saw that how these lines are formed, how there is a taut band, and then we need to find the trigger points, right? So just for the technique, the name of the technique, it's finger pads, flat finger, pincer palpation, flat hand, and elbow. This is how we find a trigger point, because uh, you know based on the, I don't know, is it possible, uh, is it possible to see my video? Is there an option to do that, doctor?
Yeah, you can do that. In
How is it?
the menu, you can see view everyone option.
Okay.
So, sorry, not view everyone, view active camera, view active camera.
I think, yeah.
Or you can see view who is talking more. Okay.
You who's talking? No. Okay. Let me see.
Yeah.
Because even when I'm speaking, no. Okay, I'll just see if everyone. Okay, view everyone. I think I can see. And yeah. Okay. So what happens is, we have the different types. We use like the finger pad, right? The flat finger. Pincer palpation is like this, right? And flat hand, elbow. So you use all this based on different locations. Now, for example, if you want to do a pincer palpation, right? The most thing what we do is sternocleidomastoid. So you can all I think you can all on your videos and see if you can just, this is how you would palpate the trigger point for a sternocleidomastoid. Is it possible to on the video? Who are free to on, you can actually on. Can you just, so that I can just show you? Or if you're comfortable to on the cameras, you can just on, so that I can just see you doing it. I'll probably just asked about 4 or 5 people. Okay, so I can see Dr. Jersul. So I'll start with you, Dr. Jersul. Okay, so Dr. Joseph, you can just look to any of one side, left or right. Okay, and you can start by the base. You can see right from the sternum, right, and you can see that you can see your sternocleidomastoid. Can you feel it?
Yeah.
See, this is called pincer palpation, and I'm using only these 2 fingers. Okay, so you can see that in my I'll just see when I just look here. So what do you do for sternocleido? You look to the left side and then you just forward flex, and then you can see how it is involved and how the sternocleido is contracted here. Can you see? Yeah. Exactly. So that is how we palpate sternocleido. Now, because we are doing an active contraction, we are not able to get it. But if you can ask somebody to sit in front of you, right, and you can ask the patient to actually just look to one side and forward a bit, and then you can see this is how you elicit sternocleidomastoid.
Yeah.
Okay. So anybody else want to try it? Yeah, I can see attendee 48. Yes, doctor. I don't know your name. It says attendee 48.
Asking me something?
Yes, doctor. Dr. Navdeep. Is that your name?
No, it's wrongly you are. It's coming. It's Dr. Sumit Chabra.
What is your name, doctor?
Dr. Sumit Chabra.
Okay, Dr. Sumit. Your name is coming in the. Okay, anyways, it doesn't matter. So, were you able to feel your sternocleidomastoid?
Yeah, I am getting, sir. Here reason, na? See,
Yes, exactly.
right.
It's always it's easy if you can start from down and go
Here.
up.
Here.
Start from
Exactly.
no. See, doctor, it starts with your sternum. Here. Yeah.
Okay.
Sternum is here. This is your sternum.
Exactly.
Exactly. So the sternocleido, and when you touch here and then you look to the other side, look to your left. Yeah. You can feel that.
Yeah, exactly.
Yeah, and it
This
starts
one.
from it starts from there and goes behind your ear to the occipital. That's how it is located.
Doctor, can you off the share screen so that we can view you better?
Okay. Yeah. Is that okay now?
Yeah.
Okay. So what I was saying. Yeah. Now this is just to get the feel of it, right? So what you do? Here's your sternum.
Yeah.
Yeah, the sternal nostril, and when you look to one side and then you just look left and flex, then you can see the sternocleido, how it's contracted, right? And it goes right behind your ear here. So this is how the sternocleido is done. So in patients, what we do exactly, you're right there, right? So since I'm sure most of you have been trying to do it, did you actually feel any sort of tenderness or pain in this area?
Yeah. Feeling.
Yeah.
Little bit pain if I am pressing this one. The pain is just circulating somewhere else also.
Yeah, you can feel it radiating somewhere else?
Exactly. It is radiating to upward direction also.
Yeah, perfect.
circulating.
Hello, Dr. Shine.
Your screen is not moving.
Maybe some network issue.
Maybe network issues. Not coming and not visible. Network issues there. Dr. Jassel. Hello. Dr. Jassel.
Yeah.
Sir, I want to ask that why my name is displaying Dr. Navdeep Nagpal.
Oh, so that's why I asked you to rename it. Okay. Okay.
Exactly.
You can
Okay.
rename it. Okay. So that's why I just removed you